This event will be recorded. Good afternoon, everyone. I want to welcome you to a conversation entitled Let's Talk About Mental Health, hosted by U.S. Congresswoman Alma S. And as we see the numbers rise in the room, everyone is here and we are ready to get started. We're going to start with the video. Is the video ready?
I'm Dr. Miriam Delphin-Rittman, Assistant Secretary for Mental Health and Substance Use in the U.S. Department of Health and Human Services, and the leader of the Substance Abuse and Mental Health Services Administration. May is Mental Health Awareness Month, and an increased focus on mental health is needed now more than ever. As President Biden has noted, our country has faced an unprecedented mental health crisis among people of all ages and backgrounds. 2 out of 5 adults report symptoms of anxiety or depression. Suicide is now the 10th leading cause of death in our country, and more than 104,000 Americans died of drug overdose in a 12-month period ending in September 2021. Despite these troubling trends, there are many reasons for hope, hope that is rooted in action. At SAMHSA, we will continue to work to improve access to quality care and outcomes for all Americans. We know that with the right services and supports, people with mental health conditions can and do recover and live full, productive lives in communities of their choosing across the country. For help finding mental health services near you, please call SAMHSA's National Helpline at 1-800-662-HELP or visit findtreatment.samhsa.gov.
Again, everyone, good afternoon and welcome to Let's Talk About Mental Health, an event and discussion hosted by U.S. Congresswoman Alma S. Now we'll hear opening remarks from our very own Congresswoman Alma S. Take it away, Congresswoman.
Thank you, Kim, and welcome to everyone. Thank you for the warm introduction. I'm Congresswoman Alma S, and I am proud to represent North Carolina's 12th Congressional District, including Mecklenburg County, the city of Charlotte, the towns of Davidson, Cornelius, Huntersville, Pineville, Matthews, and Mint Hill, and soon Kannapolis, Concord, and Harrisburg. I do want to thank each of you for taking the time to join today's discussion in recognition of Mental Health Awareness Month. Healthcare is one of my 4H priorities in Congress, along with hunger and housing and higher education. But healthcare has never been equal in our country. In the 1966 convention of the Medical Committee for Human Rights, the Reverend Dr. Martin Luther King Jr. said, and I quote, "Of all of the forms of inequality, injustice in healthcare is the most shocking and the most inhumane." In the greatest country in the world, 1 in 5 people live with some form of mental health issue. Many suffer in silence. Today, my hope is that you will leave with information and resources that will indeed allow you or loved one to keep going. Because information is power, and power is what makes the difference in lives and communities. Information put into practice is powerful. Our panel of experts will attest to the fact that mental illness is a medical condition like diabetes or cancer. And I believe that we would all agree that the COVID-19 pandemic and our nearly 2 years of lockdown, stay-at-home orders, limited capacity interactions with family and friends only made mental health outcomes worse. Mental illness impacts over 46 million people, including many mothers dealing with postpartum depression. Many people avoid talking about mental health concerns with their families, their friends, or their physicians. They simply suffer in silence due to the stigma that has been attached to mental health diagnosis and treatment. As we've seen in the recent violent tragedy in Brooklyn, mental health issues can severely alter rational thought, leading to the death of innocent people. In Congress, I work to ensure that all who need medical care, have access to it. This past March, Congress passed a government funding omnibus package that will help our communities recover from this global pandemic. The package boosts funding for maternal and child health, mental health, and substance treatment. This historic spending package takes critical steps to help students, workers, and families get back on their feet. Another piece of legislation that I'm quite proud of is the Momnibus. The Momnibus is a package of 12 bills crafted to comprehensively address all aspects of the maternal mortality crisis with a focus on Black birthing people. As co-founder and co-chair of the Black Maternal Health Caucus, as well as co-lead of the Momnibus, I know that mental health conditions are a leading cause of pregnancy-related death. And that's why it's important to me to include in the Momnibus my signature bill, the Kiera Johnson Act. And this bill will provide funding to community-based organizations to support pregnant and postpartum people who have maternal mental health conditions and substance use disorders. Additionally, the Moms Matter Act, another bill in the Momnibus, provides support to community-based programs to make mental and behavioral health treatment and support more accessible to mothers and birthing persons. Unfortunately, the statistics about mental health in America are alarming. No matter of race, level of education, or socioeconomic status, no matter of age or gender. But we cannot ignore that mental health hits our most vulnerable communities the hardest. The data tell us that over 50% of young adults have reported symptoms of anxiety and depression disorders, and over a quarter have reported struggling with substance abuse. Communities of color, essential workers, and adults who experience job loss or income insecurity have significantly higher than average reports of anxiety, depression disorder, substance abuse, and suicidal thoughts. 50% of people with a substance use condition also have a mental illness. 46% of homeless adults staying in shelters have a mental illness. Adults in America with mental illness die on average 25 years earlier than others, largely due to treatable medical conditions. Suicide is the 10th leading cause of death in America. More than 90% of children who die by suicide have a mental health condition. And so, as you see, the statistics are devastating, and there's much work to be done. And that's why today's discussion, let's talk about mental health, is so very timely and much needed. So I'd like to thank our distinguished panel of experts for leading on the front lines of the mental health crisis and for sharing their wisdom and insight with us today. I look forward to hearing from each of you, and I thank all of you for joining me today for this most important conversation. Now, let's talk about mental health. Back to you, Kim.
Thank you, Congresswoman Adams. And we are ready to rock and roll to discuss this serious discussion on Let's Talk About Mental Health. So I'm not sure, is Mr. Gray on yet? So we're going to move forward and move on to Mr. Troy Veale, who is the CEO of One Love Periodic Services. Mr. Veale, the floor is yours.
Hi, everyone. Thanks for tuning in today. It's a pleasure to be here. Thank you, Alma Adams, for inviting me. And thank you also, Ms. Ratliff, for this wonderful conversation that is very well needed in our communities today. I basically think that there's certain things that we need to do in terms of mental health because it's not going anywhere. From our organization and from our perspective, we created a specific model how we utilize or how we dictate or determine a person's mental health diagnosis. We created a process that's very unique that I think that some people need to, or other organizations might want to take a look at this. I'm also, Ms. Ratliff, in the mental health space as well as a laboratory. So we own a laboratory here in Charlotte, North Carolina, as well as mental health services. We have developed a process that we bring in laboratory science into behavioral health to help our therapists minimize the risk of misdiagnosing. because 10 million Americans are misdiagnosed each year. So therefore, if a person is misdiagnosed, then they may be working on the wrong diagnosis by this particular method. So what we've done is we brought toxicology, which is a form of a drug test, in the form of our assessment. So we'll do an intake, get the demographics of a person, and then we'll do a interview with the person to get their perspective of what's going on with them. And we do a toxicology report, meaning it's a simple swab of the mouth, and that will determine what medications that this person is on, or if they're on any illicits. That way, the therapist can utilize that particular method with some science and some facts, along with the theoretic information they receive from the client, along with that expertise as being a therapist and the DSM-5, which is the governing Bible of mental health, to help determine what diagnosis this particular person has. Because sometimes people can be diagnosed with a disability and maybe utilizing some substance abuse to cope with it, or they may be taking some type of medication that's hurting them, that's making them have a diagnosis. So what this method here does is minimize the risk of the therapist misdiagnosing, so we can try to get the diagnosis right the first time. In any event that we don't do this process, we've learned that we may cost the taxpayers money, because sometimes a client can be in a program longer than they should be because we are processing or working on the wrong diagnosis. So with this method that we have here, it really been benefiting us in terms of getting the diagnosis right the first time. And then therefore we are able to do the proper level of care for this particular individual. We know that mental health is here. Since COVID-19, we saw that domestic violence went up. We saw that things change because people are home every day with their loved ones because of the pandemic. And we realize that now there's things that's going on inside the family, and typically don't happen because the father or the mother is not in the house all day along with the kids. So from my perspective, I think that this is something we need to address in several aspects, especially in the schools. I think that we should basically have some type of measuring tool for each kid before they come in school each year. For colleges and for high schools, we do have a system here that we utilize. It takes 1.5 minutes for each kid to fill out, so we can get a general idea of what we're dealing with for the school year. If Johnny is having some issues at home during the summer, when they come back to school, there's a system that we have, takes 1.5 minutes that they fill out, and then we can tell if Johnny has some issues that he's been dealing with. He may be dealing with hunger. He may be dealing with seeing his mom or dad having discussions in the home that they don't need to be privy to. So those things, I'm sorry. So those things that we feel like here in our program that can help benefit schools and families in our neighborhoods.
All right, Mr. Veale, thank you so much for that. Mr. Gray, are you on yet? Mr. Herb Gray. Looks like he got his login, so we'll give him a few more minutes. Ms. Oates, are you ready? Ms. Oates is the CEO and owner of the Up Company. She also used to be a resident in our building at 801 East Moorhead. Ms. Oates, the floor is yours.
Thank you so much for having me this afternoon. Thank you to the fellow panelists, as well as Dr. Congresswoman Alma Adams. I'm so excited to be here. So I'm the founder of the Up Company, and our main focus is to really address cycles of traumas that have been unaddressed and passed down generation to generation, including toxic relationships. We also really have a focus around couples so that we can strengthen families, as well as around driven professionals who are usually the ones who are helping everybody else. We want to make sure that when they're in their time of need, they can also be supported so that they can in turn better support communities. I'm glad that we're having this discussion. We really need to get to the point where we can talk about mental health in a new way so that this crisis can be averted. If someone is having a mental health crisis in today's day and age, it means that they have to feel like they're crazy. They have to feel like they're demon possessed. They have to feel like they're just seeking attention. These are the kinds of things that people say and talk about mental health. We have to change the dialogue. We have to be willing to say, it's okay not to be okay. This is a brain condition. Just like we would get our heart checked, we can get our brain checked. This is something that we don't have to live with in secrecy, but this is something that we can really rally around this person and help them through it. So thank you for having me here today.
Thank you, Ms. Oates, for those comments. And now, coming to the stage is the one and only, my friend, Mr. Herb Gray. Mr. Gray is the CEO and owner of Life Enhancement Services. Mr. Gray, the microphone is all yours.
Thank you, Kim and Congresswoman Adams. Man, I'm gonna tell you, man, I need to work on my technology skills. I've been on as an attendee the whole time, but I'm ready now as a panelist, finally, man. But thank you all so much, and glad to be on here with this great group of panelists. Troy Veale really gave me the blueprint of how to get started in mental health, so I'm so glad to be here with him. But I have found that in many times I use the word Black and brown communities, because in other communities, mental health care is something that has been accepted for a long time. But I have found that, you know, over the last so many years, I've probably been doing this about 12, 13 years, owning a mental health care agency, is that it has gotten to be a little bit more receptive in African-American communities, right? More and more that as we talk about, you know, our need to take care of ourselves, not just from a physical standpoint or financial standpoint, but also from a mental health care standpoint. The more we do that on a broader scale, the more I have found that it is a slightly bit easier to get in there and talk to our people. But one of the things I do know is with our agency, I heard Troy talk about some of the holistic approaches he does. One of the things we try to do is work on individuals from job training, from housing to clothing to educational systems. So we found that some of the other dynamics we must, as an agency, assist people with, so to help them with that mental part. Many times our mental things that we're going through are from some type of trauma that's going on, right? And many times trauma is economics, but a lot of times it's just acceptance into a society or something that has happened right down the street from us or around the corner. And so how do we battle that as clinicians? Therapeutic clinicians is what we have to try to figure out. So as an old adage, sometimes we have to go a little bit further than the next to make things work. And so that's what we try to do as an agency and many other agencies that I'm aware of. So I thank Congresswoman Adams for really taking the time out to highlight this, because again, these are the things. We got it on talking about weight. We got it on talking about we want to make money. We got it on so many other things. We've got to be open to talk about mental health care as well.
Thank you so much, Mr. Gray, and thank all of our panelists today for their introductions. And panelists, if you could please post the name of your company and your contact information in the chat room for everyone that is here. So we hope to get to as many questions as possible during the next 40 minutes, I think about 41 minutes that we do have left. If we can't get to them, and if you registered and if you added your question to your registration, we do have those questions. We will definitely do our best to get those answered today. If we do not get those questions answered today, those questions and the answers to them will appear on the Congresswoman's website, which is adams.house.gov. So again, we thank you for being here for this important conversation. Let's talk about mental health. And we're going to jump right into our Q&A. Our first question to all panelists is, how do I notice the signs that a loved one is facing issues with their mental health or substance abuse? Don't everyone speak at once. Let's go.
Some signs that you want to be aware of is there should be a drastic shift in behavior. So there's all kinds of different mental health conditions, but kind of what overlaps each of them is you're going to really notice a difference in how they are at work, how they are in their relationships, and how they're showing up in their everyday life. Are they no longer being able to meet deadlines and they usually used to be able to get through them like no problem? Are they having fractured friendships and romantic relationships? Are they no longer doing the things that they once really enjoyed and what was really important to them? So those are some really important things you want to be mindful of. Some other pieces might be their appearance is different. They're not taking care of themselves. They're eating, their sleeping habits have changed. Maybe they can't sleep. Maybe they're overeating. Maybe they're not eating enough. Maybe they gained a lot of weight in a short amount of time. You want to be looking for some dramatic differences. And as people who are concerned about people in our family and our community, it's not our role to diagnose unless you're a mental health professional, but you absolutely want to be aware of those signs and be really curious.
I echo the same thing Natasha just talked about. I often tell people, but she ended on a note that I think is so important. Sometimes people are trying to diagnose people who are really not qualified to do it. But basically, I always tell people, look at it like this. You had an ankle problem or a knee problem or something like that. You wouldn't necessarily diagnose stuff. You would take it to a professional and say, hey, my ankle and my knees hurting, my back is hurting. Can you tell me what you think is going on? What, you know, and then they ask you a series of questions. And so when you look at Kim, as you say, how can you tell? It's the same things I would just lift up. Many of those things are surrounded any change in that person's personality, any mood swings, which is changing that personality, anything that you think is a little bit not where it has been traditionally with that person. And sometimes it can be a loved one that can notice that change, but sometimes it can be somebody such as a teacher or an employee or something like that nature, who can also say, hey, I think something's going on with you.
Mr. Veale, did you want to answer?
Yes, I just want to piggyback on the things that my panelists have stated before. Those are all the things that we need to pay attention to. We want to see their signs. We want to see what they're doing and see if anything has changed. And then therefore we can address them at that standpoint. So I agree with my panelists on that approach.
Thank you so much. Now we do have 3 panelists today, but we do have several other mental health experts who have tuned in for our discussion today. We do have questions in our Q&A that hopefully our panelists can answer. I know we're going to do our best to answer the questions that I'm going to call out, which are from our registrants. So let's get to it. And question number 2 is, how do I address a friend? And this may have been addressed in the first question as well, but I'll read it anyway. It says, how do I address a friend that might be struggling with their mental health or substance abuse? And this time we're going to start with Ms. Natasha Oates, who is holding it down for the ladies.
All right, so this is a great question, and I'm glad that this is posed. This means that you care about a loved one. You're noticing something drastically is happening with them. Oftentimes we're too silent. And so what we need to do is remind them, hey, you know, I care about you. I'm concerned about you. Normally, this is how you would behave with certain situations, and this is what I'm now noticing. So to let them know you're noticing certain changes, let them know that you care, you're concerned, and you're there for them, and then just be really curious about what's going on. Also be mindful of your tone. People are concerned about being judged. And what you don't want to do is say things like, you're not depressed, are you? Having a certain tone that says, you might be, but I'm not able to handle what you might say to me. So they want to know, do you care about them and are you willing to listen?
Great response. Anyone else before I move on to the next question? All right. So our next question, my insurance does not cover therapy or counseling services. Are there any free or reduced services in the community that I can use? Mr. Gray, let's start with you on this.
Okay, thank you, Kim. I would say that one, I would say it's a very difficult answer and complicated. I think there are free services available. I think that those services may be through some county agency or things of that nature. I think there's some grants that are available. Typically, we have some private pay individuals who we work the rate with. So typically, some of these agencies are at a certain point financially where they can, reduce the rate or fit the rate for that family for a particular period of time. So I think there's some grants out there that will support it. I think some county programs that will support it. I think there's some agencies that will support it. Most of our residents who cannot typically afford to pay, I would say, the market rate are on some type of Medicaid program where that would assist them financially being able to do that. And finally, I do quite a bit of my work in Washington, D.C. And in Washington, for a particular period of time for the first several months, you cannot have, if you don't have any way of paying this, and you're not on Medicaid or something like that, the city would kind of subsidize you for the first so many months. So the question is, yes, just like anything else, it may take some research to figure out how, but yes.
Mr. Oates, Ms. Veale, I got that all mixed up.
Yeah,
Ms. Natasha Oates or Mr. Troy Veale, either one of you want to take that?
Yeah, I think that every community should have access to free mental health services. If we don't have it in our local city, that's something we need to talk about, Ms. Adams, about, because we want to make sure that we try to touch all people. In the event, I know in my agency, we do allow, a couple hours a month that we do free training or we do free therapy. And then we also have interns that's learning from us as well, just because we have to give back. I mean, there's no such thing as no insurance, right? So we got to help each individual. If we have some time on our schedule, we will we will allow people to come in. And then we maybe call our neighboring agencies, say, listen, do you have any community hours? Do you have any grants along with your organization that you can do therapy for this particular client for a certain period of time? And then that client can apply for insurance. And that's what therapy is all about having resources. If they don't have insurance, why not? Let's figure out what is the problem, because that may be a reason they have a mental health problem because they're scared to go to the doctor. They may have some other issues going on. So yes, I don't think that we should turn them away. I think we should at least have a conversation with them and try to find some resources for them.
That's a great answer. So to piggyback off of that, there is a question in the Q&A that I want to ask since we're there. It says, how can we reduce the cost of Veale? Any of our panelists want to?
Let me go ahead and add some resources too before we get to that, if that's okay. There's a lot of different avenues to lower the cost of counseling services, especially if you don't have insurance. For a lot of corporations, a lot of mainstream employers, they actually pay for therapy services for their employees. It's called Employee Assistance Program. EAP, and usually it's between 2 to 22 sessions that they will pay for. It just depends. It's a part of your benefit package, so you would just contact your human resource professional. There's also organizations that offer sliding scales. So they offer a lower rate. And one website you can look on to look up which organizations do this is Open Path Collective. And then it was also mentioned that interns, so therapists in training who are finishing up their degree, they are often at different organizations and provide free and low cost therapy. So look into that, as well as local clinics. Absolutely do not allow costs to be a barrier, because there are resources out there. We just have to really look for them.
And Natasha, one more thing, when you talk about those therapies, I know Troy talked about it, you're really talking about somebody in graduate school, correct? And so if you think about it, most of those people that we're looking at, so don't look at the intern like just a freshman out, you're coming out of college, but look at it as somebody who has years of experience in doing this. They're in graduate school and probably doing some therapy on the side while they try to complete that graduate degree. So they have a wealth of experience to deal with. Yeah.
Absolutely.
Okay, Mr. Troy Veale, if you could post your contact information. I see it there, but someone else, I see you posted it at 12:21, but someone just posted about a minute ago, if you could post your information. So I'm not sure if they were on at that time and can scroll up, but Mr. Troy Veale, if you could please repost your contact information in the chat room. And we will move on to the next question. I think this is a good one, given what has happened over the last couple of months, last couple of years in our community and around the world. It says how to help someone with depression. What are some ways that we can do that to help our friends and loved ones who are experiencing depression? Ms. Oates, you look like you're ready. For some reason, on my small screen, it's just you and I. So I need to open it back up and close the chat room for a minute.
Okay. Well, one of the things about helping someone with especially severe depression, it really calls for a lot of patience and for you to take care of yourself, because one main symptom of depression is losing motivation to do basic things for themselves, especially if it's severe. So even the motivation to get help may not be there. So you have to really be in a good space to be patient and to also be supportive and encouraging. Sometimes if someone's in a severe state of depression, just sitting with them, just being with them, doing simple tasks that they don't have the energy to do. Maybe you can mow their lawn. Maybe you can bring them some food. Maybe you can send them a get well card. If someone had an illness, what would you do to cheer them up? It's the same way we need to think about it, just in a new way.
Please wear a face mask.
I'll let Troy go, then I'll go.
Yes, I like the way she answered that. I think that sometimes when people are depressed, of course we realize it, but sometimes we want to find out the common denominator or what makes them happy or what makes them smile, and try to do that. And then so we can break into what's going on with them so we can start a conversation. But I definitely believe that we should definitely find out what's interesting to them, what they like to do or what they like to talk about, especially if you're a friend or if it's a family member. It's good to find out what makes them laugh, because sometimes when you laugh, you always get an opportunity to ask the next question or to try to have a conversation with them about what's really going on. Because sometimes you have to break the ice. If they manically depressed, sometimes, may rub their back or just having a general conversation with them, but you definitely got to show that you're serious about the situation and you want to help, because people want people to help them. Some people don't want to ask questions. You have to see what's going on, and then you can ask them, what's going on? Let's talk about it. Let's take a walk. Let's take a ride. Let's listen to some music. Let's do something that's interesting to them to try to get their mind off what the issue is. And then we circle back around later on to find out what the problem is.
I echo, that depression is kind of a difficult thing to really figure out, because you can be a people person amongst a gazillion people, always the life of this, that, and the other. And yeah, you're battling depression, right? Many times we think depression of somebody who goes in a room and locks themselves away from everybody, right? But there are different things on that spectrum of depression. My mother probably had been battling depression the last 6-7 months, it was kind of scaring me. And one of the things now she's coming out of, because she's going back out and walking with her friends in the mall in Durham, right? It was just that thing, she was not getting up, going out there doing some things. So 3 days a week doing that. And that's a little bit of a turn in the corner, easier one. But again, one of the ones we want to look at are any symptoms or discussions we have with people who we assume who have it all, right? That's that depression that's really kind of weird. People have it all, and they maybe, they say, man, this person committed suicide, this person did, but they had it all. But they can still be depressed, and you kind of have to listen to what they're talking about sometimes, and you have to, with love, say, I think you may need some therapy or some counseling services, things of that nature.
Exactly. Love lifted a lot of us. I'm getting an echo for some reason, but I think the next question, all of us can attest to for some way or form or another. As we have all dealt with COVID, the aspects of loneliness, the question is asked, how has COVID impacted people's mental health? And Mr. Gray, I definitely want to start with you on this one. And I'll repeat the question for you. It says, how has COVID impacted people's mental health?
Yeah, I had some echo, and I think that's what it was. I was trying to help you out again. But
Okay.
but I, you know, it has done a lot, man. Everybody knows me, man. I'm a people person, man. So when you tell me I can't be amongst the people, man, it just blew me away, right? In the long term. And I think you have people who just could not be around people. But I think you had a fear, a real fear, right? And you know, when anytime you're up against a fear all the time, right? That does something to your psyche, right? So you had isolation, you had fear of am I going to die? You had the grief counseling because you knew somebody around you who had passed away, right? So COVID, in and of itself, you had a helplessness, right? Sometimes people, and I'm sure the other panelists understand, we provide the counseling service to kids or adults, and those people couldn't even provide the basic skills and technology to help their kids log on and stay in the academic game, right? So you had an inadequacy type thing going on, right? So there were so many things with COVID that have brought upon itself, and because it's been on us for so long, right? It's not just a turn the light switch on for a lot of us and get back out there, right? Going back to the restaurants, going back to games. And so I think COVID, not to prolong that, but I think COVID has done a tremendous job on people. And in so many cases, so many of our most vulnerable people have had to try to figure out how to adapt and deal with it.
I would love to piggyback on that too. Thank you for just those details. The World Health Organization said that there's a 25% increase of anxiety and depression worldwide throughout the pandemic. So it absolutely has had an impact just to all those factors that Herb Gray was just mentioning.
All right. Not sure if Mr. Veale wanted to answer or not, but I'll start with him on the next question. I do want to address from our chat room, Miss Dolores Sabualui. I know I probably messed that up, but I've talked to you on the phone, and I do know the correct enunciation of your name. I just want to say I do see your question that you posted in the chat room. If you could post that in the Q&A, and we can definitely make sure it gets answered either live today, or we will get a response and post it on our website. So that goes for all of our people in the chat. If you have a question, please post it in the Q&A, and we will definitely do our best to either get it answered live today or get it answered for you. But those in the chat room, the panelists may miss those, or I may miss those. I just happen to see that particular question. So thank you so much for your cooperation, and we will move on with the next question. It's a lengthy one, but I am going to start with Mr. Troy Veale on this one. And it says, please include a drug expert that can discuss all the addictions, drug overdose, or poisoning deaths. Fentanyl deaths are a big problem in the Charlotte area. I lost my 29-year-old daughter to drug addiction and fentanyl poisoning in 2018. So Mr. Veale, if you could address this, and we'll move around to the next panelist if they want to respond as well.
Okay, well, let me just give you an idea of what we do here in terms of substance abuse. Like I mentioned earlier, in terms of a acknowledging or finding out the best way to diagnose a person utilizing toxicology, bringing laboratory science into behavioral health to help our therapists minimize the risk of misdiagnosing, because 10 million Americans are misdiagnosed per year. The same strategy we kind of utilize in medication or substance abuse. When we have a client that may have a substance abuse or may be on medication, and when we send that client over to our psychiatrist to do a med evaluation to determine if this particular client needs to be on medication or not, what we do is we make sure the prescriber or the doctor prescribed the medication, right? So once the client or the patient come back the next month, we have a test that we call PGX, which is called pharmacogenetics, which is a genetic test to determine what medications work for you, Ms. Kim, or work for you, Greg, Herb. So therefore, we can identify what medication work for you. A lot of times, a lot of prescribers are prescribed medication based upon the symptoms that the patient would tell them about, but they don't know if that particular medication is adequate for their chemical makeup. Well, here what we do is we do another test. We go another step. We do a test called PGX, that's called pharmacogenetics, which is a genetic test to determine what medications work for you, not me. And with that test, it determines what medications you should take. It tells you what medications you shouldn't take. It tells you what medications you should be cautious of. Therefore, we are asking the prescribers to get the medication, the correct medication, correct the first time or the second time. What typically happens with substance abuse or mental health and all these different things, when a doctor prescribes, he's going to prescribe what he thinks that's work for you based upon the majority states. We're going to give this particular client Adderall because the things that they're telling me, we should give them this. But how do you know Adderall work for you? Like when you get a headache, everybody take a different medication, but the objective is to get rid of the headache. All medicines is not made for everybody. So I think we need to become our doctor first. We are our first doctor. We need to make sure we present this to our physicians, because a lot of time our physicians is getting you in and getting you out. They got 15 minutes to be with you. They're going on to the next person. So you have to evaluate yourself. So now what I'm doing at all our patients, like, listen, we need to make sure you are on the correct medication. So therefore we can minimize you taking all different medications or trying and error over a period of time. Let's get it right the first time. And once we get that right, then now we can actually work towards proper therapy. And a lot of times when you on the wrong medication, your body don't metabolize the medication. So you're on this medication for a period of time, and next thing you know, you can have heart problems, you can have cancer, I mean, not cancer, you can have kidneys or issues if you're not on the right medication. So the whole objective with my organization, we want to get the diagnosis correct. We want to get you on the proper medication. And once we do that, this will minimize the taxpayers' dollars, because now this client is not going from different companies for different services and not attacking the same issue over and over again. Let's try to get it right and try to help the person get to a safe haven in their community and actually get on the right medication and right therapy. That's what we should do. I don't know if that helped, but that's what I was feeling at the time.
Hopefully that is a big help to the person that asked the question. And dear panelists, we're going to ask if you could respond in about 15 to 20 seconds. We're trying to get through as many questions as possible live. Also, panelists, you can click on in the Q&A to answer those questions, and you can respond to those as well. I do have a burning question that my staff keeps asking me to ask, and that says, I am a parent of 2 high school students. I am looking for resources to help us navigate through the anxiety and depression with all the changes that have taken place in school and the ills of social media. What resources or information can you help me with my 2 teenagers? You want to go with that, Mr. Veale? You look like you're ready on that.
Yeah, after that long question, I mean, I was just thinking about what I was stating before, and I missed some things there, but I know you want to keep the answers down to 15 to 20 seconds, but I think Herb can answer this one better than I can.
Thank you so much. So, I tell you, there are so many resources out there, but again, as I said before, I can't do it in 20 seconds, try to get, where they need to be. It could be mentoring things. I mean, I use 100 Black Men of Charlotte as an example. It could be those type of outlets that are very good things for children, whether it's Boy Scouts, whatever, that'll be great for it. But it could be a more serious thing, such as counseling. And I think what you have to do probably is independently, as a parent, try to find out if it is counseling, what is the best therapist I could have my, like I said, sons go to try to assist with them. And so I would say, in short, you have to find out, is it some type of positive mentoring type of organization they can join, or social organization they can join, or is it the counseling?
I would also add, really get in touch with the school social worker or the school counselor as well. They have a wealth of knowledge about resources for young people. They may already have programming in place. A lot of times there are programs happening, but we just don't know about it. And I would also say for parents, it's a beautiful thing to really create the village for your child, but also work on yourself. The more that your home is a place where there's peace, it's going to be helpful for your child too. Oftentimes we are taught to be silent about what's going on with us, to push through, and we don't even take care of ourselves, but scratch our head when we see maybe sometimes our kids are struggling too.
Yeah.
So very true. The next question kind of piggybacks off of the responses that you gave for that one. So thought it was a good segue into this one. It says, and this is from the Q&A, says, can you discuss the shortage of social workers and mental health professionals? I've been unsuccessful finding a therapist available in the Charlotte area to provide care for my depression and grief. And that question comes from Miss Betty Anderson. Panelists.
So Kim, I would say that's a, you know, whether you're in Charlotte or wherever, it seems to be somewhat of a shortage. Now, I'd say one thing, so, you know, that it has come out of COVID is the ability to have telemedicine, telehealth procedures through therapy and counseling, right? I think that it would be great if people can have a face-to-face sit down with somebody, but if the need is there and you find a therapist who's in Chicago or Houston or wherever, I think that there are telemedicine services now that are excellent that can assist that person right here and right now.
Yeah, I have a response to that. There are a lot of kids that's going to school now, and their interests are focused about making money. In the social work field, it's not a field that there's a lot of money that can be made. So therefore, the reimbursement rates and the things that people can make when they come out of high school or college, a lot of kids are not choosing this unless they have a passion to help people, because now the economy is going up. Everything is is more expensive than before. And in the social work field, there's just not a lot of money poured into it. They're just not having a lot of money for the therapist. There's not a lot of money for this particular service because I don't know why, but this is very intricate and very important to us. So there's not a lot of funds going there. So a lot of people are not going to college now to pursue social work or sociology or psychology anymore because of the lack of the funds. So I understand in each area, like Herb said, all over the country, there's a shortage of therapists because people are not going to school for it anymore.
Mm-hmm.
I'm so glad this got brought up. I think since there's viewers who are mental health professionals, and then we have the panelists, it's also up to us to sow the seeds in young people about what is possible. And not everybody in this field is broke. So let me just take that stigma away too. But so a part of what I do, you know, they have career days at schools. There's mentoring opportunities. At one point in my practice, we took on interns. So it's also a responsibility of us to get involved. There's less than 5% of African-American therapists in this country. And we live in a diverse country. We all need to be represented. We need to feel like my therapist understands my cultural experience. So we would love for you listeners, if you're interested in this, to also get the education and training and join us.
Amen. Thank you, Ms. Oates, for that PSA. There was a question that asked about this particular session. This is actually being recorded. We're broadcasting live through Zoom and on Facebook Live on Congresswoman Adams' Facebook page. We will post the recording on the Congresswoman's page so that you can review it later and discuss with your family, friends, all of that. So we are still going to continue with the questions. And again, like I said, we're going to do our best to get as many answered today. If we do not get your question answered, we will post those questions and the responses to them on the Congresswoman's website, which is adams.house.gov. So our next question is, how can we proactively advocate for mental health checkups for youth or anyone who works with you? I think that's an excellent question. Mr. Veale?
Yes.
Ms. Oates?
I think that typically when you have a session and once the session is completed, you should schedule your next session and keep scheduling your sessions until the therapist feels like that you're making progress. And I think that most times when people are doing therapy, they have goals, they have things they want to achieve. And once they achieve those things, they go on to the next goal. But I think after every session, you should reschedule another session just to check up on or have a conversation of how the last session went, or in your next session, you can proceed with things that you're trying to get done. Because I think 1 or 2 sessions is not going to be enough. I think that you should always keep communication with your therapist. So therefore, if anything happened in between time, this appointment and next appointment, you write it down or you contact your therapist about it, because we got to keep mental health live. We got to have a conversation about this regularly. So yeah, just basically, after your session, just schedule the next section.
Awesome. I would also say, use your voice. Show up at the school board meetings. Let organizations that work with your children, let those leaders know that there are certain needs and you want to know how they're going to address them. Go to that school counselor, that school social worker, and ask them, hold them accountable. What are programs that they're offering? Let them know what you're seeing on the ground in terms of what's going on with the youth, and ask them, what are they offering and what can you do to help? I would also say, get educated about coping skills that you can use yourself and teach your kids, so that whenever they're going through some things, they have some things to fall back on. So absolutely use your voice.
All right. I was trying to find a question that staff sent me. I don't see that one just yet, but I do have one from the Q&A that I want to ask of the panelists. It says, please explain to me about post-traumatic stress disorder and obsessive compulsive disorder. Panelists?
And Kim, I don't want to give them the bad information on that one. That it really is. Sometimes we diagnose things. I don't want to give it the wrong response on that one.
So they should reach out to the individual facility and get a better response on that. Is that what you're saying?
Well, there are licensed therapists who can explain it totally, right? But if somebody's trying to diagnose themselves, whether or not they have it, I think that's where the danger zone comes in, right? It's better just to find a therapist and say, this is what I'm dealing with. Remember I talked about that knee or that ankle, and just see what they say from there. But I'm might afraid we might give bad information where they don't need to be in that lane.
Okay. So we'll move on to the next question then. And I appreciate everyone for posting, our experts for posting their contact information in the chat for people to find you beyond today. So the next question says, how do you balance supporting a friend or family member with addiction while upholding your own boundaries? For example, if one wants to support someone with an alcohol addiction, but is feeling worn down by drunken phone calls. Wow. I'll repeat the question again. It says, how do you balance supporting a friend or family member with addiction while upholding your own boundaries?
This is a really good question, and it's kind of connection is with what someone asked before. How do you approach the substance use issue? It's important of how we talk about substance use in our families. What are we saying to one another about the family member where it's obvious that there's a problem? Are we urging that person to get help? What enabling actions are happening in the family that remove consequences from their own actions? Because those are usually what are really helpful in getting someone ready to get help, especially with substance use. It's a tricky thing because when it's blood, you want to be there for them, you want to be loving, but you can't do it at the extent of your own detriment.
Yeah, that's a very, very good question. I'm gonna go off the limb to say a lot of times when we have family members that's presenting problems, I think sometimes you may mention it to your family member, but I think it's always best to get advice or see therapists that's outside of the family, someone that you can have a connection with yourself, that your family member don't have that same connection, because your family member can be biased and tell you things that you want to hear, which you need to talk to your therapist, and your therapist can give you options on what things they suggest for you. So sometimes getting out of the norm, I know growing up, we typically, or going to church, they really didn't believe in, therapy. They just felt like the devil was in you. But nowadays, therapy is relevant. So we need to reach out to someone outside of the family to help us provide those services, opposing, dealing with someone inside the family.
Last point on that, Kim, I echo what they're saying. Also by saying sometimes an addiction is something deep rooted in something else. And you being your brother, your sister, your cousin, you might need a whole independent person. So I would always continue to push that person to have a licensed addiction counselor or somebody like that help them, because you might not realize that addiction is buried in there for something else that they're trying to heal with that drinking or heal with that drug or something like that.
Thank you so much, panelists. Our time is winding down. This was a very great discussion. And one thing I did want to say before I turn it over to the Congresswoman for her final remarks is that all of our panelists today just so happen to be HBCU graduates. So we've got a North Carolina A&T Aggie, we've got a North Carolina Central Eagle here, and we have Livingstone College own Mr. Troy Veale. So thank you all so much for being here. Again, hopefully you all can respond to some of those questions. I'll be looking to you to get all of those answered for us, as we will post those responses on the Congresswoman's website. So at this time, I'm going to turn it over to the godmother of the HBCUs, the one and only.
Uh-oh.
Rose? Congresswoman, you're on mute.
Okay, go ahead.
Hi, Kim. Did you need me to, are we finished?
You can give your closing remarks.
Well, let me just say I have enjoyed listening and I've learned a lot, and I'm especially interested in all of the comments in the chat. And there was someone in the chat who asked about sharing this information with the public at large, which clearly we need to do. But this is being taped, isn't that correct, Kim?
It's being recorded, yes,
All
ma'am.
right, so it's being recorded, so we can provide the recording for folks who need it. And someone in the chat, I was reading all the information of the questions, and I think that's important. And I'm not sure if anybody, I'm sure this has been a very in-depth conversation. I want to thank each of our speakers, Natasha Oates, Troy Veale, and Herb Gray. But I want to just say, having had conversations with my daughter, who's a principal, in Guilford County who sent a question, and I don't know if it was ever addressed, but she's, her school is kindergarten through fifth grade. And these kids, some of them, one in particular that she's talked to me about, is having some real serious problems. So we can't forget the youngest of children. This child, I think, is maybe adopted, but the point is he's having some real issues. And I just wonder, as we talk about this whole issue around mental health, that we, you know, that hopefully there's some resources available for young children, and for teachers and folks who are actually working with young children in the school. So that, you know, so on behalf of Principal Lindsay, I'm asking that question, or at least I'm putting that out there. But to say to the public who joined us today, it looked like we had a big crowd. We will have the video on, once we get it straight, we'll have it on the website, Kim, is that right?
Yes,
Okay.
ma'am, that's correct.
So people can access it that way. But I just want to thank you all very much. I know I'm off script, but you know, nevertheless, all I want to do is to say thank you. Mental health is an issue that we need to continue to talk about, but we need to provide those resources that are necessary to address the problems. But for all the work that you're doing in this space, thank you all so very much. And we'll have you back again so we can continue this conversation, because it's not going away and we must deal with it. So thank you all so much.
Thank you.
Thank you, Congresswoman. And if you want to reach out to our office number is 704-344-9950. And our website is adams.house.gov. And look forward to seeing you soon. Thank you so much. Let's Talk About Mental Health was a great discussion. Have a great day, everyone.
Thank you.